So hi, I'm Dr. Grace, and my background is I'm a gynecologist. And what brought me into this field of aspect is, well, as a woman myself, I care for myself and my well-being, and I've always had gynecological problems, so that was a start off. And then after that, after having my first child and my second child, going through all the different changes in life, whether it's mentally, physically, or just all over in general. I tell my husband, like, I feel like I really want to apologize to my patients after becoming a mother because a lot of things were different than what I thought it'd be. It was so different telling somebody else that it's easy to be done that way or it should be done a certain way or a certain treatment can be provided to prevent something as opposed to experiencing it yourself personally. So that really, really touched me and really want me to really engage in the aspect of being able to help more women, because it really hit me that not only it changes you on the physical side, but mentally and all the hormonal changes. And if only we could maybe just stabilize it throughout the whole process, it would be so much more rewarding for the woman to become like a different phases in life, whether it be turning into a mother or stepping into menopause, which I haven't so far, but I'm hoping that I could help myself at the same time help more and more women down this path of aging. Well, just like I always tell my patients, they are always constantly questioning me. Why are these things working when I apply it to my vagina area or to my intimate areas? And I tell them the reason being is that the mucosal area of our vaginal area is very, very delicate. So the component of our female genital area is very unique. So from the outer appearance, from the labia majora to the minora, it's a combination of normal epithelium, so like normal skin. So there's a protection. But once it enters that midsection where the mucosal area, so there's like a breaking point between the two. So you can actually flip out your mucosal layer and you'll notice there's like a borderline. So once it passes that part, there is no more epithelium. So that is why it is so delicate. So think of it as you're drinking hot soup. So it would burn your mouth like right away, as opposed to maybe touching the side of your lips because there is a protection of epithelium. So that is what it makes it so delicate. So it's constantly being affected, not just by the outside environment, but with their hormonal changes. So it not only changes according to maybe temperature, to weather, even to abrasion of your clothing, but at the same time, let's say a woman is going through menopause, having some hormonal changes, that's gonna affect her drastically from the inside out. So you have patients stepping in and telling you, I have symptoms. I feel like my intimate area is about to crack. It's very like, you can't actually picture it portray until you actually experience it yourself. It's like, I always tell my patients with a lot of like descriptions, because for them, it's very, very unfamiliar. So I tell them it's like watching TV, having your mouth open for about 3 minutes and then stretching your mouth right away and it will crack, and then right away they get the whole image. So that is what is happening with this mucosal area, and because it's borderlining in two areas of epithelium and non-epithelium. So sometimes it's really hard to explain to your patients why it's effective on the inside as opposed as of the outside. But over time, as women are becoming more open to this topic, I think they're able to accept it more and at the same time understand the need for it to be cared intimately. Just like for our face, we have our facial cream or face wash. For intimate areas, they should use intimate related products as well because it is so delicate itself. Well, the options, I mean, honestly, over the years, I think the market itself, or just not even just the market, I would actually say just treating female with intimate problems, the field is actually growing, but at a very, very slow pace. So I've always been waiting and so anxious for maybe perhaps a new potentially weapon or a treatment method. So over the years, there's always been medication, perhaps thermal energy, and maybe some electromagnetic frequencies, stuff like that. But all in all, it has its limits. And in the past, one of the most used product or treatment we provide is with like perhaps PRP or with regenerative treatments. But with the introduction of exosome, it was a game changer because over the years, like even I was talking to a doctor just earlier today, they were telling me, do you still use PRP as your treatment protocol? I tell them, yes, it's been like this for the 10, 15, 20 years. It is one of our basic protocols when it comes to treating female intimate areas when it hits like a mark where you can't go up anymore. But over the years, we've been always waiting for a new thing to launch. And Exosome was a game changer because for a lot of people, it's new. And over the years, I think the past 3 to 5 years, Exosome has been the newest thing. But it never hit us that it would actually step into the group of intimate area. But now that it has, and so far, my usage of it has been amazing. Not only does it provide a more rapid effect, also a very long-lasting effect as well. So for me, this is very new and very rewarding for females down this path of aging. Well, as we all know, Exosome is very new, and for the intimate area, it was just launched just a year ago. So to a lot of patients, it's very unfamiliar, and a lot of people step back. But the thing is, I have a really close bonding with my patients, and this is what I'm really, I guess, proud and happy to say, because I spend a lot of time with my patients through consultation, long hours of explaining to them, and this is what brings us close. So to me, it is not just selling a product to my patient. No, it's like I'm providing you with a better option, a better way to your problems and a better solution. So for us, it's actually just introducing, I was, hey, do you see this new thing on the market? Like, it's almost like a new trend in clothing, whatnot. So for them, it is not me selling products. It's me being able to help them with another method. So honestly, it is not as hard as I thought it'd be. So when patients stepped in, I actually have patients stepping in and telling me, hey, have you heard of the new thing? I think there's an exosome thing, right? Is it for the intimate area? I don't even need to step in and pretend I'm trying to sell her something. She actually comes in with these new ideas. But why? Because they have problems that actually maybe some doctors actually don't see when we're treating in general gynecology. Honestly, when I was still in the hospital, these patients would come in and they tell you, I have problems like this. And you treat them with A, B, C. And that's about it. And you just, scratch it up a bit. You scramble them up, A, B, C, C, D, A, A, D, C. And overall, like, patients come in and they feel so helpless. But then a lot of times it is not because the treatment is not working, it's because you don't hear your patient's problems. So that is one thing I've been building with a lot of my patients. So all my patients are like really good friends with me. So we're like buddy buddies, like best girlfriends. So for me to just tell them a new product or new invention that may help in a certain way, right away, like, okay, I would love to try it out. And so this is what is also rewarding for me. And I'm able to accumulate a lot of experiences through my patients' feedback and this close bonding with my patients as well. Patients are not familiar with science, but to them, like paper, documentaries, and honestly, a lot of commercials. But for me, commercial is not a big thing. I like to provide my patients with real evidence-based stuff. So I provide them real cases that I performed on. Even on myself, I tell them my personal experience after using the product. So to them, it is not as unfamiliar. And at the same time, one thing all women are fear of, aging. Do you want to be able to cling on to that last end of your hormones? Maybe this would help. And like I said again, by bonding with my patients, it's not like selling a product. It's like introducing a new thing. Hey, have you seen this new thing on the market? It's so cool and it can really, really help. So for them, they're willing to take that step into trying the product. And for me, because after trying it myself and a few of my really close patients, it was really, really rewarding and the results were amazing. So for me to tell my other patients that are actually still gazing, uncertain of whether or not they want this treatment, I can almost tell them, trust me, try it out and you'd be amazed. And then the results were actually according to what I said. So that makes their patients want to try even more and actually introduce this product, this thing to their friends as well. And then even when they feel better, like even with their partners, they tell you, oh my God, do you know what has changed? And they would tell their girlfriends over like an afternoon tea, have you know what's different? Like they're glowing because for a lot of hormones, it's because the stability. So exosome itself not only changes, I think, female confidence, it regains this, I guess, female rights over their own body. So they feel more confident at the same time, they feel more comfortable. So their friends and family around them, I'm sure they feel that vibe as well. I have patients telling me, hey, my family tells me I'm glowing, I look different, I feel more confident because you're not feeling uncomfortable anymore. I don't know if it occurs to people that are watching this clip right now, for a lot of women to actually be able to really experience what it's like to be in pain just walking, waking up in the morning, going to the bathroom, urinating, and it's excruciating. For them, this is a game changer. So a lot of times I actually don't need to spend a lot of time telling them. I just tell them, try it out and tell me how it works. I don't even want to act like I'm trying to sell your product. And they try it out and they feel shocked and they're awed with the results. My consultants are always telling me, you are spending too much time talking to your patients. But that is a problem. It is a pro and it's also a con, because I spend a lot of time, like I said. So they're like my really close friends. So when something new is launched, it's easy for me to tell them. And regardless if it's exosome or a new application, a new appliance, or even a new thermal energy that has been introduced. So I tell my patients, this is really good and perhaps you wanted to give it a shot. And also I think one thing that really helps is, I guess, social media. So I've had my little thing in social media for the past couple of years. So a patient would actually step in, even new patients, they've never came into a clinic before, they would step in your room, and then the moment I pop the door, it's like, oh my God, you're in person. I've seen your videos before. So they feel like they know you even before they meet you. So that brings that bonding even closer before even starting the conversation. So for, I guess, a lot of people, I think it is also a thing I tell my younger doctors is actually a good thing if you're not shy, of course. I don't like to do something that will make you feel uncomfortable, but because I am so talkative and I love making friends, I love sharing things with a lot of people. So I guess that really helps as well. So when people come into my room, they tell me, you look just the same as you look on the video. Or when I see you on TV, I'm like, am I supposed to look different? Because I feel comfortable this way. But it's also another thing, because if you're shy, it's hard. For your patients to open up to you, you have to open up to your patients too. So this is what I tell the younger doctors or people that are actually wanting to step into this field of intimacy. This is so crucial and so important to be able to build that trust and bonding with your patients. All in all, I want to thank you again for this interview, but I am very flattered and very happy to share these thoughts with everybody, because it is a new introduction of our new product. But like I said, I don't like to sell or like merchandise this product because I'm using it, but because I think it really works. As a woman, I think for a woman to be able to have good product like this that may help you every step of the way. Honestly, I have patients coming at the age of 20 and I'm like, I'm actually wondering, why do you want this? And like, I want to stay young because I'm still young and I want to stay young forever. So I guess for a lot of patients, they tell me, hey, when can I use this? When is it good for me to have interventions or preventions or even have, an overall care for my intimate area? I always tell them, any part of the way, as long as you have you step into womanhood, when you start to have your menstruation, this is where it starts. If you have a good idea of perhaps in the beginning just hygiene, basic care for the intimate area, if we have like a better idea for prevention, in the future we have to do less and less profit on what treatment, because in the past as doctors, we've always been treating problems when it shows, but we're actually hoping that maybe there's a product or even an earlier phase where we can intervene, where a problem is not yet a problem, and we can do a lot of intervention and prevention. So again, thank you for this great product, and I'm hoping that more and more women can come acquainted with this product and help them down the way of aging.